Hello, everyone, and welcome to our event today. Thank you so much for joining us. My name is Elias Shakur, and I'm a PhD student at York University, where I'm studying health, aging, and equity. Thank you for joining us today virtually for the launch and panel discussion of our brand new research report titled, "It's Got to Be About Safety, Public Services That Work for LGBTQ2+ Older Adults and LGBTQ2+ Workers in Canada." This report was produced by the collaboration of research partners from the Canadian Union of Public Employees, EGAL Canada, and the Social Science and Humanities Resource Council Partnership, Age-Friendly Communities Within Communities. Throughout the event, you will get to hear from the researchers themselves as they will go over the process which led to the final report. You will also get a chance to hear from the people with lived experiences, either as older adults or workers within the public service, where they'll share their experiences with us and reflect on the report as well. You'll also get to ask some questions, which you may have throughout the event by using the Q&A message function, which you can find at the bottom of the screen. So throughout the event, you can go ahead and put your questions there, and we'll collect them and ask them to our attendees at the end of the event. So I'm just going to share my screen here with you. There we go. So, there we go. So as I said, we will start by talking with researchers about the project and the different details in it. And in part two, we'll discuss we'll hear from our attendees on their own experiences as older adults and as workers in the system. So first of all, I'd like to welcome two of our researchers who worked on developing this report. First off, we welcome Dr. Susan Bradley, who is the Associate Director of the SSHRC International Partnership, Age-Friendly Communities in Communities, International Promising Practices, and an Associate Professor of Social Work at Carleton University. Susan has researched and written about care work, aging, and the public service delivery for over a decade. Hi, Susan. We'll also be joined by Christine Streeter. Christine is a fourth-year PhD candidate in the School of Social Work with a specialization in political economy at Carleton University. As a social worker, Christine is committed to improving insecure working conditions for care workers. Her research efforts focus on precarious work, safety at work, and conditions of work during the pandemic. So I'd like to turn now the mic to Susan and Christine so they can tell us more about this report, the process, and the findings. Go ahead.
Great. Well, thank you so much, Elias. Good afternoon, everyone. As Elias mentioned, my name is Christine, and I was hired on the project as a PhD student to complete the research, and Dr. Susan Bradley, who you'll hear from in a second, is my supervisor. And in my time today, well, our time, we would like to briefly share a little bit about the research study itself. But before I get into those details, I'd like to highlight why we're all gathered here today, which is to discuss the main findings of this report. Overall, we believe that in this report offers many promising practices that offers ways forward towards safety and accessibility for LGBTQ2+ workers and older adults, while also pinpointing to the problems that need to be addressed. This report is the first research study that we know where the conditions of work for LGBTQ2+ workers and the conditions experienced by LGBTQ2+ older adults have been studied together. What we learned is that safety and accessibility are strengthened and developed by attending to both of these things, both employment and service delivery. You cannot have safer, more accessible public services for LGBTQ2+ older adults without creating safer, more accessible working conditions for LGBTQ2+ workers and vice versa. Our intersectional approach attends to the differences among LGBTQ2+ workers and older adults to show some of the ways that racism, sexism, colonialism, as well as homophobia and transphobia must be confronted to shape safer, more accessible public services. And finally, our research showed that safer, more accessible public services were accountable to their communities and not just their funders. These services' governance was inclusive, funding was reliable, and training was of high quality, in person, on paid time, and included everyone, including managers. Next slide, and over to you, Susan.
So it's just wonderful to be here today. I am so thrilled to see this project come to publication so that it can be used. And it was only possible because of collaboration. This was something that came up for the Canadian Union of Public Employees. It also came up for our research team in the course of our research that began in Toronto and Ottawa, has now gone to Bergen, Norway, and next up we'll be going to Halifax and Copenhagen. And so the opportunity to come together with EGAL, who is also a partner on our project, and work collaboratively as a team for the last almost 2 years has been absolutely phenomenal. And I think this collaboration is a bit of a model for how we can do meaningful, high-impact research. We really appreciate our research partners.
Excellent, perfect. So before we get into those research details, it's important to clarify some of the terminology in this project. As we all know, language is important and dynamic and can deny or affirm people's identities. So deciding on which acronym to use for the project was a big conversation in our team. CUPE's National Pink Triangle Committee uses the acronym LGBTQ2+ to refer to lesbian, gay, bisexual, trans, queer, two-spirit, and more, where EGAL uses the acronym LGBTQI2S, including lesbian, gay, bisexual, trans, queer, intersex, and two-spirit. We were debating going back and forth with the acronyms, but together we decided that the Pink Triangle Committee's process for deciding on the acronym of LGBTQ2+, it was thorough enough, and so that is what we agreed to use. You might also hear me using the term queer, which I may use also to encompass this acronym as an umbrella term for sexual and gender minorities who are not heterosexual or are not cisgender. One participant made this comment: I think two-spirit should be at the beginning of the acronym to acknowledge that two-spirit Indigenous people were the first sexual and gender minority people in North America, and also to demonstrate solidarity with them in this period of truth and reconciliation in Canada. And we thought that was worth sharing. When we discuss accessibility in this project, we're talking about physical, economic, as well as social accessibility. And when we refer to safer spaces, we are referring to space where people feel comfortable expressing their gender and sexual diversity without fear of harassment, violence, or discrimination. Next. Too often, queer older adults do not receive the public services they need and deserve because these services are not safe for them. Too often, queer workers do not experience safety on the job in public services. So in this project, we asked two simple questions. What barriers and harms do LGBTQ2+ older adults and workers experience in using public services or working at public services in Canada? And what can these public services do to improve accessibility and safety for LGBTQ2+ older adults and workers? Next. To find answers, we used an intersectional approach informed by feminist political economy. We conducted a research literature review, as well as a national environmental scan. And I won't go into the details about those two, but you can find more of those details in the report. We also learned from queer older adults and public service workers. I was able to interview 4 older adults and 4 workers, and I also completed 2 focus groups, one with 4 older adults and one with 4 workers, for a total of 16 participants. Most participants resided in Ontario, while others were from British Columbia, Manitoba, Nova Scotia, and Saskatchewan. The older adults participants' ages ranged from 59 to 76. Workers came from healthcare, municipal services, and social services. And what was interesting is that some of the older adults have or are presently working in public services and made comments about both perspectives. And some of the workers are older adults using public services. Participants identified as lesbian, gay, trans, two-spirit, and dyke. The participants were recruited through EGAL and QP. Data from the interviews and focus groups was transcribed, coded, and analyzed via thematic analysis. And we found 5 main findings from this analysis, which I'd like to share now, along with some quotes from the participants themselves. I'd like to reiterate Susan's note on collaboration. Although I'm the one presenting these findings, the write-up of the report and the whole process itself was truly a collaborative effort. I'd also like to just preface these findings to note some of the troubling quotes that you may hear. The interviews that I was honored to be a part of and trusted with were real and raw, and in most cases extremely upsetting to hear, let alone, for the participants themselves to experience firsthand and then have to relive by sharing with me. And so I preface these findings, but also just note the strength of these participants and the care that our team takes with these stories. And so I say that also when I assist hetero women talk about this project, I share these findings as a intermediator in collaboration with these folks in order to try and get this important information out, to give it the attention that it deserves to try to improve public service safety. Next. And so the first finding we reported is that queer older adults and workers experience a barometer of safety in accessing, using, and working in public services. Both older adults and workers reported experiencing a spectrum of danger and safety in public services. Queer communities know some services are particularly dangerous, where older adults and workers have experienced physical and psychological assault. One older adult in Ontario reported traumatic experiences, saying that if you're trans and you're a certain age and you don't pass, it's very difficult accessing services. And the most difficult thing of all is to go to the bathroom and to not get harassed. I have been harassed. I've been physically assaulted going into women's washrooms because they think I'm a trans man. Yeah, and this happens 2 to 3 times a week in any public space. And this was only one of many quotes shared in relation to this finding. However, at the other extreme of that spectrum, some public services are well known to offer high levels of access and safety, where queer older adults and workers can be out, gather in community, and have working and living conditions that affirm their gender and sexuality. We found that most services and spaces fall somewhere in between. Next. The second finding showed tremendous diversity among queer older adults and workers. For public services to be accessible and safe, these differences need more attention. Racism, transphobia, and other systems of oppression need to be dismantled. Queer older adults are immigrants, Indigenous, Black, racialized, white, low income, high income, rural, urban, and more. Those who are trans or lesbian, gay, queer, two-spirit, intersex, bisexual, and questioning face all different realities and experiences. One line from an older adult in Ontario summed up this finding well. There are not just generic queer seniors. Next. The next finding showed that where queer workers are safer, queer older adults are safer, and vice versa. Accessible, safe services for queer older adults require environments where queer workers are represented and safe themselves. One worker from BC pinpointed this connection well, explaining, "I want to be more comfortable with where I work because at any given moment, I can become a patient in the facility I work in." Older adults look for indicators that an environment is safer. Seeing and interacting with community members who are out at work is a critical sign. Further, queer workers are consistent leaders for safer spaces. However, our research shows that public services workplaces are not safe or affirming for these workers. Next. Finding number 4 shows how responsibility for making public services safer and accessible has unfortunately been disproportionately placed on workers, with insufficient accountability placed on managers, owners, board of directors, governments, and accreditation agencies. Our research confirmed that public services download responsibility for access and safety to workers through often insufficient training of questionable quality, or by relying on training from underfunded queer, volunteer, charitable, and nonprofit community groups and organizations. One worker from BC shared, "We need support, we need friends, we need education, because the responsibility shouldn't come back on all of us. I'm not the poster child, nor is anyone else that I know of for the LGBTQI2+ community. No one is. It's a group effort and we need everybody, and we especially need people like you who will help us in that." From participants' feedback, it's clear that training must be high quality, properly funded, and accompanied by goals, monitoring, and accountability at all organizational levels. Next. The last finding, which related to our environmental scan, revealed some leading organizations and many promising practices in Canada that offers us ways forward toward access and safety for queer older adults and workers. So ending on a more positive note. Some public services have committed the resources needed to make these important and necessary changes. We've seen changes that are visible in a range of areas, from governance and accountability to service delivery, physical environments, websites, working conditions, programming, outreach training, and more. Many organizations are striving to learn, integrate, and maintain this type of approach. Next. And here are the promising practices that we did highlight, which I'd like to share. So, shifting power to diverse queer communities, ensuring queer representation in policy and practice decision-making, engaging in organizational change to affirm queer service users and workers, ensuring queer representation and employment equity in the workforce, ensuring meaningful training throughout organizations to promote queer safety and accessibility, as well as making visible queer affirmations in signs, symbols, and celebrations. All of these work together to create safe, accessible public services. 1 is a start, 2 is momentum, but all are needed. Next. So what does this mean for LGBTQ2+ older adults and workers? Well, I'll pass it back to Elias to introduce you to Robert and Gina. I think you're on mute, Elias.
Sorry about that. Thank you so much, Susan and Christine, for this presentation, and really for giving us a detailed rundown of this report and all the work that went into developing it. Would you be able to tell us where it will be available for people?
That's a great question. I wish I knew.
Hi.
Okay,
Hi.
Susan, thank you.
I'm going to put the connection for the report into the chat, into the Q&A, so that everybody can get it. It's going to be mounted in a few places, on the project site, on my website, the Care Work Aging and Health Lab, and on the QP site. And so I'm going to put in at least one of those places in the Q&A in just a few minutes.
Great, thank you, Susan. So again, as Susan just said, just a reminder, if you have any questions about the report, please put those questions in the Q&A section that you can see at the bottom. I already see that there are some Q&As coming in. We're going to collect them and ask them to our participants at the end of the event. And now we would like to hear from people who have actually experienced the public service either as older adults, LGBTQ2+ older adults, or LGBTQ2+ workers in the system. And first off, we'd like to welcome Robert Nelder. Robert is a member of Toronto Seniors Pride Network, or SPN, which is a program for seniors at the 519 Community Centre in Toronto, and he is on SPN's Education Committee. Robert is also a past member of the National Seniors Advisory Council for EGAL Human Rights Trust. Hi, Robert, how are you?
Very well, thank you. Real pleasure to be here. And one thing I didn't put in my talk, which I've just scribbled down here now, is that I'm 79, will be 80 this October. My partner and I have been together for 44 years, and we got married 9 years ago, next month. So that's my personal history back there. And before going to Newfoundland, I worked with the Toronto Separate School Board for 30 years. And in that time, we managed to set up a group called Teachers for Social Justice. And at one point, united with some other unions and so on, about 30 of them, it looks like here, we put together, In Search of Safety, the Lives of Lesbian and Gay Youth. I mean, back then, it was lesbian and gay. Bisexual was something that just some people talked about. But the two main areas at that time were that. And I, despite what people may hear and think about the separate school system, we had these printed up for every Catholic high school to use with the students. And as a matter of fact, at one point we got a question saying, "You better hurry and get the rest of them delivered because the Archbishop's going to find out about this sooner or later." But we didn't have any trouble there either. And when I was retiring, I was asked, would I speak to OECTA, the Ontario English Catholic Teachers Association, and the topic was, what's it like being gay and teaching in a Catholic school system? So I had lots to say there as well. Mm-hmm. And at the end of it, this big burly guy came walking up to me, and I thought, oh God, he's going to smash me. And he said, "My brother's like that. Thank you." And then he left the room. He wasn't a teacher. I don't know where he came from. Somebody must have invited him. And so that was how I ended my teaching career. And then my partner and I went to Newfoundland, where I was originally born. And when we were there, two things happened. We saw the movie Gen Silent, which a number of people have probably seen by now, and how the queer seniors are treated in homes and in services and so on. And the other was I came back to go to a SPIN conference, Senior Pride Network, entitled Opening the Closet on Aging. And beside me in the first talk, it was about trans and so on, this woman sitting beside me, she was getting very twitchy and nervous and so on. And I turned to her and I said at the break, "Would you like me to get you a coffee?" And she said, put her hand on my hand and said, "No, stay with me, because I know that I will be going into a home, and I don't know if they're going to put me in with the men or with the women." Mm-hmm. Those two events got me involved then in Newfoundland, and then eventually back here in Canada, Newfoundland and Canada, back here in Toronto. I got working with SPIN and also with one of the long-term care homes. They wanted to have a connection and so on. Mm-hmm. So none of that is in my prepared notes, so I don't know how much time I've got left now. But anyway, what I've done too, and Christine, I might be copying a little bit of what you just said, but I'll change it where I can. But I mean, for me, the basic idea throughout my life has been safety. I remember the first time when another partner of 3 weeks held my hand walking down Bathurst Street, and I was almost wetting my pants because you just didn't do that. Mm-hmm. But he came over from England and they were further advanced and blah, blah, blah. So but it really made me nervous for a while. So anyway, so it's really interesting that the topic of this paper is, it's got to be about safety, and I really think it is, and that's why the whole discussion there resonates with me, because that safety has been a major part of my own life. And like when we talk about, well, what do we mean by safety, workers or elders or anybody for that matter? It's not experiencing discrimination, not experiencing harassment or violence, being treated with dignity and respect, and the paper addresses that. And services must be accessible for everyone, those who need the services and those who work with them. It's absolutely got to happen that way. And before I go any further too, I have some stories about myself where I was not very well treated, or I certainly didn't feel safe in certain circumstances. And so when we go through some of those parts, or I go through some of those parts and how it resonates with me, I might be telling a story there as well. So right now I'm presently working with another group, which is working on housing for seniors. Can't tell you anything about it because it's top secret. But recently, in connection with this, I came across an article called Canada ... LGBTQ baby boomers in need of safer housing in senior years. Mm-hmm. And it's written by Professor Jacqueline Cahagan from Dalhousie. And she says, and I really agree with her, that despite recent advances to human rights protection for LGBTQ Canadians, many are now experiencing challenges in meeting their housing and health needs in old age. And she maintains that the reason for this system, reason for this, stems from a long history of discrimination, harassment, violence against queer Canadians, simply because of their sexual orientation or their gender identity. So right now, we're in the COVID years, months, well, almost years. And I was doing research on suicide in our community, our queer community. And I went on Google, and there were over 400, and I was concerned about suicide, what was happening. And in over 400 articles, one was on seniors, and the rest were on youth. And the youth are important, and we know that that's important. But it would appear that the voices of older LGBTQ plus elders are absent from any discussion. And as a result, many of these seniors are choosing to go back in the closet. When I was giving a talk last year to a CARP event, and I made a big sign, LTC, and I said, "What does this mean? LTC, long-term care." Yes, yeah. No, long-term closet. Our people are going back into the closet in long-term care. And that's a sign that change. And this, I think this paper will help to make that situation better. So let's see now. Okay, so this study, which we have before us, is concerned about how safe and accepting the health services are. And the writing team wants to prevent harassment or violence from service providers in long-term care homes from residents, because it happens there too. And I'll just give you a brief story right there. I was going to mention it later, but in one of the nursing homes that I was connected with, and I actually, with another friend, recommended that this person go there. And on the third day, a worker walked into his room and said to him, "Oh, are you the new gay guy, or are you a faggot?" And of course, he was shocked and trembling and so on. And when his husband came in, he told his husband what had happened. His husband talked to different people to see. I was back in Newfoundland, but he talked to some people, and they suggested that he talk to the manager. And when he went to see the manager, it appears that nothing was done other than moving the worker to another floor. And that's not the way you deal with that kind of a situation. I like in the first part of the report, and I think Christine has quoted this person before from Saskatchewan. He said, "So safety would be knowing that if I'm going to come out and share what my family is, why it's structured the way it is, then I feel safe, that I'm not worried about being isolated or made fun of or whatever. I feel that I'm comfortable enough, in a comfortable enough place to be who I am." And it follows that if the workers feel safe, the clients receiving the services would feel safe. And I certainly feel that. I had a bad situation in one hospital. I went to another hospital. This guy behind the door did everything but hug me. He was so attentive, and how could he help me, and so on. And I just thought, well, God, he's working here. I've got to be in good hands. And if I'm not, that's who I'm going to go and see, right away. So I think in order for this safety to be developed in each home or in each clinic or whatever it is, and it's mentioned in the report, the importance of cultural competency, which means for me, not about us, without us. Mm-hmm. We have to be included in it too. We don't want other people just talking for us. Thank you very much. It's much appreciated. But we want to have a share and a say as well. And let's see then. So I mentioned cultural competency and also cultural humility. Mm-hmm. And that's a term that may not be familiar to many people. And I just began to learn about it about 2 or 3 years ago, I think. And it's a term that refers to self-reflection of one's own prejudices. Where I'm coming from, what am I bringing to this situation? Engaging in self-critique, addressing power imbalances, and so on. And I think that's going to be dealt with too around the situation of color and so on that our Canadian society is going through this year. But having this kind of training, I've seen it where both the elder people in long-term care and the workers that are gay working in long-term care, they come together with the manager or the person in charge, and they help to make up the program. So I've said here that I've seen this, and where I've seen it particularly is in Fudger Home, the 2 Rekai centers, and Kensington Gardens. And at the Rekai Center, what they do there, they give the person who's applying for a job, whatever level, doesn't matter, and they have to read this form over, and it spells out the community, the queer community that they have, and that they will not tolerate any kind of transphobia or homophobia or whatever. And then before the person signs the application to work there, they sign that letter that they've been shown. And I think it's really working well, because the people there definitely, I think, feel much, much safer with that. But one of the difficulties, though, with the training in long-term care is that the government a couple of years ago cut back. The number of hours was cut back. It's about 27, 30 minutes now. Might be up to 40, I doubt it. And if it wasn't for Josh Matlow, the counselor, those of us who were working on the revision of the diversity manual, we wouldn't have been able to have any influence on those people. So we need people in high places as well to work with us. At this point, I don't know if anybody know, who do you think would have the highest suicide rate in our community? Who might that be? I'll give you some statistics, and it should spell it out for you. In Canada, you are more likely, twice as likely, to be a victim of sexual assault if you are lesbian, gay, or bisexual. than if you are heterosexual. And if you are trans, violence is a continual threat. In Canada, 68% reported verbal harassment, 37% physical intimidation or threats, 16% reported physical violence, and 26% reported sexual assault. This is from a magazine called Transpulse. And the suicide rate then should come as no surprise that it's in the trans community.
So Robert, have you seen any changes then, other than what you just spoke of about the different programs in different places? Do you think there is a more societal change that's happening or that you think needs to happen?
I think it's changing, but it has to change faster now because with COVID, there were 9 senior pride. There are 9 senior pride networks in Ontario, and they presented a submission to the Long-Term Care Commission, and it's called a call to action, and they were trying to get the number of gay deaths in long-term care homes. We know how many deaths there were in general, over 3,000 deaths. They couldn't get a number at all, and it's really kind of discouraging that in the midst of this has to come out. But I mean, you have to put that in with everything else that's gone on in long-term care. And I just noticed today, I get from the Teachers Union a publication about what's what and what's happening. And one of the writers, a woman, talks about a group of doctors that have gotten together now, and they made all their suggestions as to what they think should be done in long-term care homes and so on. But they don't mention LGBTQ at all. They don't mention the fact that if you are a member of a family of choice, you are not allowed in.
Yeah.
You know, for a while there too, they weren't allowing any families at all, period. But it stops right there. So I think all my feel-good stuff, and I just learned this a couple of weeks ago, that in answer to your question, yeah, I was feeling pretty good about how things were going, but now this is sort of throwing me for a loop. Okay, so yeah, as one gay activist who labels herself as a queer dyke activist, some of you might know, who she uses dyke as an activist term, and she doesn't see it as a bad thing. A couple of years ago when I was doing some cultural competency, there was 2 social workers. There was one shaking his head, and I finally got the best of me, and I said, are you disagreeing with what I'm saying? And he said, well, I've been taught my whole life never to use the word queer, and you're using it all the time. And I said, well, it's taken me 3 or 4 years, the last 3 or 4 years, to get used to using that term. But you know what? It is more inclusive. I can remember, and I know, like as a kid, be called queer was the kiss of death. You know, it just made your life absolutely miserable. So Leslie says that, oh, I just outed her. Sorry, Leslie. We are dying alone. Families of choice are not allowed to visit homes. She hadn't heard anything from a friend of hers, the guy who was in his 90s, and he had been in this home for 10 years, and she had met him and visited him frequently. And she hadn't heard anything from him or about him for about a week. And she went and spoke to some of the workers, and they looked at her and didn't say anything. As she was leaving, a worker took her aside, looking both ways, and said, he died a few days ago. So, in answer to your question, no, it's not. But one of the things that I did come across in the submission to the Commission on COVID was an obituary of a man who was a professor Douglas Chambers, and he was a big help to me when I was at the University of Toronto doing my teaching studies and so on. And he really, really helped me to come to terms with myself. That was back in '69. And I was, what was I? I was born in '41. You do the math. And anyway, he was really great. And he stood in such, it was so different talking with him, because at the same time at the University of Toronto, I went to a psychiatrist. And at that time, being gay was not who you are, but what you do, you know. And it was like, it's something in your system. If you get rid of it, you'll be fine. And so I went to him and he said, well, what I suggest that you do to get it out of your system is to go and get a woman and, pardon my French, F her silly. And like, that might sound really weird, but I was told the same thing in the confessional. I was brought up Roman Catholic, and when I went to a priest, and he said the same thing. Like, it just showed, like, at that time where psychology was. But now we know, like in '73, with the APA coming out and taking being gay off the mental illness list, you know. And I just learned last week that they have done a similar thing with trans, which is great. Okay, so I want to tell you one more story before I move on. Is my time okay?
We're almost done, but if you want to tell us one more little story, and then
okay, because this is tied in with.
I'm sure it's great. So that's
okay. And this is the story of Joan, and she was a woman from out west, and she was in her late 70s, I believe, and her health wasn't so good. She had health problems, but her capacity, she was right on to things. So when she moved into this home, a few days after moving in, and all her dresses and shoes and everything else, she went to see the director or manager, and she had a list of things she wanted. I want to be able to wear my dresses, my blouses, my skirts. I want to be able to walk around in my high heels. I want to have my makeup, and I want to put my jewelry on, and I want this and I want that. And when I die, I want on the tombstone, Joan, loving mother of, and then the names of the kids. And he said, fine. And he wrote down, and he signed it, and she signed it, and so on. And that went fantastically well, but it was right up until she lost capacity. And then as soon as she lost capacity, her son, who also had power of attorney, her son went in with garbage bags and threw all her blouses, everything that all her dresses, her shoes, her makeup, everything. And then as he was going out the door with his bags, he turned to the manager and said, and on her tombstone, it will say, John, loving father of. Well, he had the power to do that because he had power of attorney. Long-term care homes, I don't think, do that sort of thing. But everything else, and as I was telling this story, and these were all upper leaders in the home, staff leaders, and they were all nodding their heads. And I said, "Oh, so have you heard this story before?" No, but we've heard situations like that. It happens every day. And when I asked them what they meant, they said, well, you know, once the person loses capacity, the person who from the family, they can just come in and do whatever they want. And we can't, it's not right, but we can't afford to take them to court. But the reason why I want to include this story is because I also have done elder abuse workshops and so on. And it was in my preparation for that, given by elder abuse people, that I learned that you can see elder abuse on the street. You don't have to do anything about it. You can go psst or whatever, but you don't have to say anything. At the back of your church going in, you can see, wherever you see it, as long as it's outside of a long-term care home or a retirement home, both, you don't have to report it, but if it happens there, it has to be reported. This what happened to Joan, what happened to are you gay or are you just a faggot? it hurts. That's elder abuse.
Yeah.
And that has to be recognized and has to be brought to the attention of the authorities. So the thing with the homes is that they have to be notified immediately and they will take over from there. So I know there's some parts, and I'm really looking forward to what Gina is going to say about some of the other things, but I think that I cut out a few things, but that's okay. Thank you.
Thank you so much, Robert. Thank you for sharing, and thank you for all the work that you've done as well. It's sure it's been a big journey, and I'm very grateful for you and all of that you've done as well.
Thank you.
Yeah, thank you. So now we'd like to hear from another perspective, and this is one of a union worker. So I'd like to welcome Gina McKay. Gina is a queer Métis labor movement leader, activist, and facilitator from Winnipeg, Manitoba, on Treaty 1 territory. She is actively engaged in the regional, national, and international labor movement, and is a proud working member on numerous equity and human rights committees. And by day is the labor director at United Ways Winnipeg. Hi, Gina.
Hi, Elias. Thanks so much. Thanks for the introduction. And also, Robert, thank you for your meaningful remarks and perspectives on the report, the findings, the personal connection to the work. And for me, your perspective really reminds us that it's at the heart of this collaborative work and that we're advancing the rights and also providing the necessary tools for enhancing these structures. So both in unionized and non-unionized workplaces, but moving it forward in creating safer and more inclusive spaces for all. So I thought I'd just jump right in. The importance of this report, the project and the findings remind me that it's really the strength of the LGBTQ2+ community, unionized workers, and research collaborations that will contribute to the structural and systemic changes that are needed in every community and territory in Canada. So today I'm joining you from Treaty 1 territory, home of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and homeland of the Métis Nation. So as an out queer unionized worker who's worked in community health sector for most of my career, I know firsthand about the need for safer and more inclusive spaces, especially having worked most of my career as an HIV and sexual health facilitator in the prairies. So I've worked many years in frontline services and have learned that it's in unionized spaces that equity-seeking workers have the opportunity to build in language in their collective agreements and can move workplace policies, structurally inclusive language, and inclusive governance forward. So in meaningful ways, and they're reflective of the membership or workers in this case. And those accessing services as well as in the services that are provided. So years ago, as a CUPE 2348 member, doing divisional teacher trainings for school sector teachers and support staff in Manitoba, I learned that not only was our provincial curriculum fundamentally out of date, so it was 20 years at that point, there were also major gaps in provincial legislation around gender identity and gender expression. And so you might wonder why I bring this story up. But for me, as both a labor activist and a service provider, trainer in sexuality and sexual health, I was curious how I could empower service providers in our trainings to help to play an active role in their workplace and in unions to advance the rights and protections that were missing from our human rights code in Manitoba and still are with gender expression to date. So this began a long and exciting path forward. It's very exciting for me. I love this work. But as the union is the place where we can advance the rights of workers, so to in turn impact and affect the services provided in our communities. And these are in progressive and exciting ways. The It's Got to Be About Safety report is an example of exactly this. So when we advance the rights of workers and create safer and work to create safer and more inclusive spaces in the workplace, we essentially create spaces where workers can thrive in their work and bring their whole selves to the work that they do. So these practices inform policy, contracts, collective agreements, workplace governance, and together all of these pieces have the potential to structurally lay the foundation for creating stronger public services for those accessing care. So I'd like to speak about two of the findings in particular today that really resonate with me. And the first one is finding number 3. So that one is the conditions of work that Christine walked us through are the conditions of service provision where LGBTQ2 plus workers are safer and LGBTQ2 plus adults, older adults are safer and vice versa. So as LGBTQ2 plus workers, it's important for us to be able to model healthier and more inclusive relationships in our service provision. So this, through talking openly about our lives ourselves as we choose, in the same ways that holistic models of care provide person-centered care, and respectful workplace policies outline the ways that workers can uphold these rights and create shared spaces. So it's not a safer space for us to talk about our own lives in the workplaces as workers, then it's not a safer environment for those accessing services either. So when workers and those accessing services are denied these rights, with each conversation and with each action throughout a day, they are spending times rethinking ways of communicating or not communicating, who they are, their personal experiences they share, etc. And this is a reality for many LGBTQ2 plus workers, and it's a health and safety concern. And that's why this report has got to be about safety. I think that if our public services could look at structurally enhancing the workplace, from governance to programming to policy, programming can be redefined in tangible ways. So when we feel included, respected, and valued as workers, we in turn create spaces that celebrate these strengths, and it's reflected in the programming that we provide and the environments we create for those accessing services. So some of the ways that workplaces can do this work is through creating a statement on equity, diversity, inclusivity, and putting this into action, using the report in that way, prioritizing working groups that can evaluate the structures and systems, right down to building in more inclusive and meaningful ways of communicating safety. Further examples of these actions include programming that is more inclusive and reflective of communities and the lives those accessing services live. So intake forms that are respectfully asking about relationships and identities. And if family members are filling out these forms for loved ones or friends, that there are ways of engaging with those accessing the service if they're not out, or if these family members or friends. So forms, questions, data collection, all of that has the ability to be inclusive and respectful, but it is dependent on the questions that we choose to include or not. So therefore, we communicate the conditions of the space from the very first questions that we ask. And that really spoke to me. This finding also speaks to great truths to the values and the environment of the workplace. A little bit further, we've heard that long-term care services often split residents or clients or those accessing services up based on very binary structures. For example, a men's wing and a women's wing, right? We hear that language, it's built in. Or even limiting the definition of couples accessing long-term care facilities together. So oftentimes LGBTQ2 plus people are denied the same rights as non-LGBTQ2 plus people in this environment. So what we know as a result is that we have the ability, especially in unionized workplaces and public services, to increase visibility of these safer and more inclusive spaces, provide meaningful programming that prioritizes equity as a foundation as opposed to an add-on, and to educate and enhance the ways that we train workers. So, and this is in ongoing ways. It's not just an onboarding 1-hour discussion or 15-minute briefing, but it's ongoing. And we can learn from our unionized workplaces in this way that it's possible to prioritize employment equity measures and also give language to the ways that workplaces and workers can create these spaces that will impact all levels of public service delivery. So that's the first finding. I'll be conscious of time too. I'll wrap up the second finding. Yeah, we're good. Okay. So the second finding I'd like to speak to is finding number 4. And that one's responsibility for making public services safer and accessible has disproportionately been placed on workers, leaving managers, boards of directors or governors, governments, and accreditation agencies less accountable. So Throughout the interview process, having been a part of some of the research, it became more and more apparent that the work of creating change in so many of our workplaces and in regards to long-term care relied heavily on those in the LGBTQ2+ community to lead the way or share informally in their own networks what services were inclusive and what services to avoid. And this is an informal community function. So what I learned from this process is that formally and informally through the project is that we have a responsibility to provide and to promote and to fight for the protection of public services so that there isn't a higher dependency on private, personally funded services and care. So if we can enhance existing public services to be safer and more inclusive of LGBTQ2+ older adults and workers, we can minimize the need for community members to personally fund alternative options to care. The division, this division creates class divisions within the LGBTQ2+ community and disproportionately affects racialized, Black, trans, Indigenous, persons with disabilities, and low-income LGBTQ2+ people. And all people accessing services deserve dignity and respect because public services are for everyone and for the public good. And private care leaves people out, and in many cases, these private institutions are not upholding even some of the same standards of care compared to public services. So what I brought forward in the project and what I love to talk about in unionized spaces is that structural change needs to happen in order to create measurable accountability. So it could be a whole thesis report, I think at this point. But one way to do this, and in really practical ways, is that we can share this report, right? It's through accreditation bodies. We have these processes in place. And so as a union member who has spent weeks working through the process of accreditation in a community health center every few years, and it was a really long process and really important. I know full well that workers need to lead the process in our workplaces. We're the ones making the work happen by bringing voice to some of our own experiences. So if we can create measurable accountability around safer and more inclusive services, this can be a part of accreditation bodies. I see this as a practical and meaningful step towards ensuring the safety and accountability of our public services. And how we can bring this forward is by ensuring accreditation bodies create measurable and mandatory standards so that licensing and health transfer credits are dependent on meeting these standards. And when a facility is privatized or private, accreditation should still be needed for licensing because workplaces and institutions should not be able to go around safer governance models for healthcare and long-term care in Canada in 2021. And to date, there are no measurable accountability standards for health and safety acts either to include safer and more inclusive spaces for LGBTQ2+ people. Collective agreements in unionized workplaces can ensure these provisions are bargained for into the contract, but it's also imperative to create the structural change through legislation to ensure every community upholds the rights of LGBTQ2+ people. So having worked in the HIV movement for almost 20 years, I met hundreds of people who only wanted to return home in many cases in their final years, moving from bigger city centers back to Winnipeg and Brandon and different communities throughout the province. Some were older in age, some younger age groups, but what they had in common is that wanting to live their life and their final days in lives with dignity and respect, and to have the option to stay in their home community if they so choose. And in most cases, the long-term care facilities would not accept them, and they moved to Winnipeg to find alternative options. And so what I've learned from this work is that change is needed in every community and that change is needed across the board. And this is why a national and coordinated response is needed so that every community and public or private services are held to the same standards. And the report shares all kinds of ways of building in structural change, through personal experience and stories, to research and shared knowledge on building equitable services, to creating cultural safety standards, to the importance of equity audits and competencies in curriculum and licensing, to employment equity, to proactive collective bargaining strategies. So understanding this intersectionality of these experiences and barriers for workers and those accessing services is foundational to the work. And it addresses multiple disciplines of oppression experienced by LGBTQ2 older adults. And just to wrap up, at the core of the report and findings, for me, every part of this work has to be about safety and ensuring the human rights of all are not only upheld in our public services, but also that everyone should have equal access to services that are inclusive and respectful, no matter who you are or how you identify.
So Gina, before I let you go, you talk about the structural change and a lot of the change that could be done in the unionized environment, but we're also seeing a lot of privatization in the public services. So one would ask, what role can a government play to make sure that these types of equity-based protections are there? And do you think there are conversations that are taking place to, incentivize governments to put legislation into place or regulations like that?
Yeah, absolutely. Great question. So yeah, absolutely. There's an unbelievable role to play. And I think right now, especially in what we've learned through the pandemic, is there are differences between public services and private services. We see the rates of infection control, and we see the rates, there's differences, substantial differences. And our accreditation bodies have different standards, and there's ways around it. And in an environment where a private service offers opportunities to, higher class and folks with more wealth, then we're disproportionately affecting huge portions of our communities. And so the role that a government can play here is key, is looking at the importance of public services, enhancing those public services, building in opportunities for unionized environments, non-unionized environments, equitable, in finding a string for and a place for equity members to come together to help inform those practices and move them forward. We see health and safety codes and we see human rights protections different in each province, right? So, gender expression isn't something that is in our human rights code here in Manitoba or in Saskatchewan and Northwest Territories. So what does that mean on a provincial level for our provincial services? Right. So we need to be able to look at those protections and find ways to strengthen our public services. But also we have an opportunity here to create standards so that all of these centers and these organizations come into the fold of public services. Health and equity should never be governed by wealth, right? And we need to socialize that wealth, and we need to bring in these core concepts and work them into our human rights acts and codes and protections and everything. So I really do feel like civil society as well as government. We have this, our partnership here is a perfect example of that. We have a union, we have the labor movement coming together with research and community and prioritizing the lives of people. It's a perfect model to roll in and to ensure that all long-term care becomes public.
Mm-hmm, mm-hmm. I think we have a great roadmap that you've just told us about, and hopefully this report will also incentivize the start of this conversation on a broader level to make sure, because that everybody in Canada has these protections, and not just, let's say, people who are living in the big cities. You have to remember that Canada is massive, and the experience of the city is not the same as the experience of the rural areas. So, and the way you pointed it out, how national standards can go a long way in helping with that. So thank you so much, Gina. I really appreciate your input and your thoughts on this. It's been great to learn the great work that the unions do. So I'm happy about the great work that you do. So Now that we've heard from our researchers and from people on the ground, I'll just like to maybe give a little bit of a summary before we go to some of the questions. So we've heard about the findings of this report, where the safety of LGBTQ to older adults is pretty much linked to the feelings of safety of LGBTQ2 plus workers. LGBTQ2 plus older adults and workers face stereotypes, exclusion, discrimination, harassment, violence, like we've heard. As well, we can't forget that racialized, Black, trans, Indigenous persons with disabilities and low-income LGBTQ2 plus people face the worst conditions. And thinking about it in an intersectional way and the intersections of all of these nodes of oppression, how it could also affect older adults that are people of color and LGBTQ2 plus. Also, responsibility for making public services safer and accessible has fallen disproportionately on workers, letting managers, owners, board of directors, governments off the hook. So that's something that should change. And also there's great work happening. There's templates to move forward with this type of work, and more changes needed at the system level. So hopefully this report will be able to be a catalyst for these types of discussions, and we'll see more protections for LGBTQ2 plus workers and older adults become more common in all of Canada. So yeah. So I'm gonna now move back to some of the questions that we've received, and received a few questions here. Let's see. First question is from Ian. Ian says, I thought that the recommendation and reasons given to place the 2S ahead of other letters in our community acronym was an excellent and enlightening one. The research presenter acknowledges this point, but didn't act on the recommendation. Why is this? So I think, Susan, you might be able to tell us what was the thought process on this.
Yeah, and thanks for that question, because I agree. I think that is the direction we need to be moving in, and so that's my personal decision. However, the Pink Triangle Committee at CUPE reached their agreement on the acronym through democratic process. And so we really wanted to respect that this was a large group of people who had really thought and talked and come to an agreement about that, and to change it because of a small group that included some of those folks, but not all of them, and to change it at this point was probably premature. So, you know, our whole initiative has been about walking this walk together, and about involving lots of voices and lots of people. And so while we love that suggestion and wanted to make sure that we include it in every presentation, we also really believe in collaborative democratic process and involving as many voices as possible. And that's why we decided to go the way we went.
Great, thanks, Susan. I have another question from Deborah. Deborah says, curious to know if there were any differences in lived experiences between Indigenous and non-Indigenous seniors, and how they perceive public safety. And number two, when Indigenous seniors were interviewed, did they share any stories about being queer and Indigenous in terms of traditional teachings? Who would like? Christine, would you like to?
Yeah, I can take that. Thanks so much. Well, thanks, Susan, for responding to the other question, and thanks, Deborah, for your question. It's such an important one. So although we were able to have some diversity within participants, the majority of participants were significantly white. So unfortunately, we only had one Indigenous participant, and I think that's important to mention. We highlight that in the report, so it's certainly a limitation within this research. And you know, we absolutely support future research in this area. It's so needed. So this conversation was limited. This participant was also part of the focus group, so regrettably, I think that also left less space to discuss specifics. But one difference that they did discuss was around shorter life expectancy. So pulling from the report, there's a quote, and they said, as an Indigenous person, it is rare for us to live long lives. You know, we maybe have a handful who are in their 80s and 70s. So I think, you know, this report didn't necessarily highlight those stories in terms of traditional teaching, but this glimpse of reality and needs were mentioned, which allow us to highlight that this needs to be taken into account in public services in terms of paying attention to health issues at younger ages and Indigenous older adults. So thank you again for the question. These intersects and differences in realities and teachings and learnings are really important.
Mm-hmm. Thanks, Christine. I have one more question here, and I thought it was a little bit interesting. Would you say, especially after completing this research report, that discrimination has cumulative effects, so that people who can experience discrimination along multiple dimensions, in this case belonging to the queer community and being elderly, do in fact experience greater amount of discrimination than individuals who belong to just one community? If so, and assuming this was within the scope of the study, were there any quantitative measures of the degree of discrimination being experienced by research participants for this particular intersection? And just to note that the person who asked, Suleiman, his background is in economics and not intersectionality. However, the question is very intersectional in nature, I'd like to say. So who would like to reply to that? Susan? Yeah.
Yeah, that's a terrific question and a thoughtful one. So there were no quantitative measures in the study, although we covered a lot of quantitative literature in our literature review, an extensive amount actually. And I would say that that in thinking about intersectionality, it is important, I think, to consider that we not only have vectors of discrimination that people experience and the cumulative aspects of it, which I think there's something to, but also there is the privilege that we all have and the support that we all have. That means that it's not always about cumulative discrimination, but about the ways in which we are all situated in different relationships of both discrimination and privilege. And so being able to think about that and to be able to think about also the nature of the discrimination, because it's not all the same. And so just thinking that through is something that's a huge debate, both on the ground amongst activists and also amongst theorists. So you've identified a brilliant question, and I know this answer isn't very satisfying, but it's not as simple as just adding it up.
It's somebody's PhD thesis, maybe. So, yeah. So we have a few more questions here. One of them, so there's two that I can bring together, but there's one question here about public safety again, because we spoke about public safety. The question comes from Oliver. Similarly to Deborah's first question, I'm curious if there were any ways of perceiving public safety that were specific to trans folks. With Christine or Susan? Susan, yeah. Or Christine as well, yeah.
Sure. Christine, do you want to take it first or do you want me? I mean, there certainly was a lot.
You can go for it and I'll chime in if I have
Okay. Okay. So there's a lot in the report that's specific to trans. And that came out very loud and clear from our environmental scan, from our literature review, and a little bit from the interviews. But what there is growing evidence. I mean, Robert already highlighted the risk of violence that's so much higher for trans older adults and for trans workers. We certainly heard from workers about challenges in the workplace, We certainly see that in the literature, there's differential perspectives on trans, depending on how cisgender operates in terms of the individuals involved. So there is a ton of work to do to better understand and advocate for trans older adults and for trans workers. We continue to fight those fights.
Mhm.
Yeah, I mean, I would echo Susan's points there. We saw those differences in realities on both sides with workers and older adults in terms of workers, in terms of the difficulties faced compared to other folks who even to get employment or to keep that employment. And this was seen in the literature as well as in the interviews. And then similarly within discrimination and harassment in terms of looking at safety for trans folks. The quotes that are shared in the report and the information that's shared in the report, I think, really highlight that unique experience. But it's certainly an area that needs a lot more attention than it's been getting.
Gina and Robert might have something to add here.
I was already making some notes on another one. So, I think no matter what, this is a stepping stone, right? So for any community, Indigenous communities, BIPOC communities, folks, everyone in LGBTQ2+ community, I think it's a place where, yes, we have the sampling group and it gives us the work to take a first step, right? And I think oftentimes we can say, how might we be able to build this forward? How can we use this tool? How do I bring it into my union space? Maybe I'm in a non-unionized workplace. How could I incorporate some of this? And I think that is really important to note because whether it's a trans experience in Indigenous, there's multi-layers of discrimination and oppression that individuals experience. And so when we can look at it in ways of, let's not wait until we need to, in an acute way or in a crisis way, create a safer space. Let's do the work before. Let's start now and start looking at ways that we can build this. And I think the report, once you have a chance to look through it, will give all kinds of ideas and perspectives, personal perspectives, but then a foundation for being able to incorporate any perspective, whether that's a cultural teaching, cultural safety, etc., forward. So I think no matter what is, we can look at this as a starting place, but it's something that hasn't happened before. And I think that is important to note, that it's a first of its kind to say this work can happen and it's happening in informal ways. So how do we ensure that everyone has that access?
Mhm.
I don't know if that answered it, but I was all over.
Yeah, if you want to add to it, there's actually a question here that says, what role do unions can play in this?
I could, and then I'll pass it over to Robert. I can speak to that. I think what's great about a unionized workplace is that you have the tools. We bring ideas forward as members from experiences from our work sector and our workplaces. Every voice is important in that process. We have the tools like writing resolutions, bringing them to our conventions and being able to have important discussions about them. But also what happens is that we have bylaws and policies in ourselves for our locals that can help guide this work. Another step of what's important there in the way that unions are doing that is that, there's councils that come together, there's committees that come together on national and provincial ways, as well as on a local way. And when you look at all the ways that you're engaging worker perspectives, we have a lot to learn from that collaboration and that work. I think unions are a bridge between the workplace and this incredible process that can bargain in language, collectively bargain in language that can go further than some of our human rights and our legislation where it might be lacking, or that pieces are being removed, right? And so when we can ensure that these workplaces are a priority through our contracts, we can build campaigns, and really bring that to light. I've seen that happen in a long-term care facility in Winnipeg where, it was about the workers as much as it was about the service users as well as family members. So you look at what is holistic care. If I'm a queer person visiting my grandma in a long-term care facility, I might experience discrimination just by visiting her, right? And then what are those tools? And in a public service, we have those protections built in that we might not in other homes or services. So I'll pass it to Robert there. I know he wanted to.
Oh, thanks. I can remember a number of years ago being invited to a conference at Jarvis Collegiate on trans. And it was the first time I had ever knowingly been in a trans situation, both people in the audience, the people on the stage talking to us. And I found it really liberating. And I thought it was fantastic how these, particularly the trans women, could talk about their changes and reactions of people and so on. And then a few years ago, I was with a trans friend, and we were down at the 519, and we were just going out for a walk. And I said, well, let's walk over by Jarvis Collegiate and down. She said, no trans person is going to be around Jarvis Collegiate. She said, they just get beaten up around there. And I just thought, how ironic that to go from the Jarvis Collegiate had this image for me of positivity towards trans people. And then now how it's changed. And it's, I just see that in my life, these changes that are taking place, and not necessarily, well, not that anyway, that wasn't for the good, but being there at that time and hearing the people's stories and so on, that was a really positive experience.
Mm-hmm. Robert, since you're on here, there's one of the questions that asks, would it be a good idea to kind of replicate the gay straight alliances that we've heard about in schools, where LGBTQ2 plus students with straight students, they kind of create like the safe space in their institution. One of the questions that were asked here, is that something that could be replicated, for example, in more seniors places such as long-term care homes or?
Oh yeah, well it is. I mentioned Rikai, and actually at True Davidson, I was one of the people that worked to start it up there, and I got a letter from a new person there just the other day, an email saying, would you be interested in coming back? But I was told like 5 years, and my 5 years were up, and I looked elsewhere. So I got involved with the Rikai Center. And now the great thing there is that Barbara Machalik, who started up, they have a couple of GSAs. They have a GSA for fun, and they have a GSA for planning. And sometimes they do get together, and they have people coming from other homes to see, well, what are you doing and how does it work and so on. But the interesting thing there too, and I want to put in a plug for the Rikai, is that they have 25, well, you know where they are at Sherbourne and Wellesley, and then just down the street on Sherbourne. But now there's a possibility of another place, a new place being built. But even in their Sherbourne place, they were looking at, okay, we want to put aside 25 rooms. And usually they say beds, but that's another whole story. Rooms. And they met with the members of the community and so on. And like, do you want to be separate? Do you want to be integrated? What do you want? And it was sort of a toss-up of different things, but what it was yes, we'd like to be integrated, but we would also like to have an area that sort of reminds us of our community. So the posters on the walls and the signs, anything that's there reflects the reality that they come from. And there's a person there I've wanted to meet for a long time, but I can't because of COVID. But I was talking to Barbara the other day, and when things open up a bit, then I'll go and see what else can be happening there. But no, that's my experience with that. I know we have time for one thing, clarification. You know, the 2S thing. I went to a conference at the University of Toronto, and they had students from out west. How come they were from out west? And they were almost all Indigenous, but they kept referring to themselves as gay and straight and queer and so on. And I said, how come you're not using two-spirited? And they said, well, that's a central Canada thing. It's not all over the place. So, I mean, this just adds more to the story of should it be at the front or should it be at the back? And maybe it's from the Christianization of some of these groups that therefore they don't want to use 2S, even though they are 2S themselves. So it's still out there. Yeah.
Great. Thanks, Robert.
Okay.
So we're almost at time. We have still a few more questions, but I think we've covered most of the questions that have been asked. I just want to open it up if anybody has any last remarks you'd like to leave us with before we say goodbye to everybody.
I would like to have an exchange of email addresses.
There's actually somebody sent you a message in the Q&A, so we'll make sure you get that. So perfect. Great. So thank you so much, everyone. Thank you, Robert, and thank you, Gina, for sharing your experiences and your views and thoughts. It's very much appreciated, and we appreciate the emotional effort that goes into remembering all of the life experiences and all of the traumas that you might have experienced in your life. So we thank you so much for sharing this with us. It's a great growth opportunity for everybody to be able to learn from your experiences and from the great work that Gina and QP and the unions are doing, and hopefully we'll be doing at a national level as well. So hopefully this report will be able to generate some of these discussions. Thank you, Susan, and thank you, Christine, for all of your great work, and appreciate it. And just a reminder that the report will be posted online, so you'll get, and it's also posted in the chat, so that it will be accessible for everybody. And yeah, anything else, Susan?
Yeah, and we'll be sending out the link to the recording to all the registrants, along with a link to the report. So you will all receive both links with you. I have your registration, so that will be available. And of course, all the panelists will also receive that so that they can distribute it. And thank you so much for attending. We appreciate it.
Thank you so much.
Spread the word.
Yeah.
Thank you, Elias.
Yes, thank you, Elias.
Thank you.
Thanks, everyone.
Great. Thank you, everybody. And
Thanks, everyone.
great rest of the day.
Bye-bye.